We know that you can have SM and autism, and it's difficult to diagnose for some. But that what I see with individuals, the biggest things that I see for differentiation is the internal motivation is just not there as much with individuals on the spectrum. They just don't have that internal drive. If I do this, this will lead to that, which will help me do this. That is what I see as a big key factor. Do you see that?
I don't know how much of that I see, but I think that what you were saying is that the children with in the spectrum, they don't see ahead in terms of intentional and a more abstract kind of planning,
Yeah, that's
manipulation,
what, yes.
or and when we
Right.
speak, like you just use, I can just use an example of what you just said. You said this serves as a segue for something else. So you're already linking what we were talking about to something else that you want to talk about. So that's something that is difficult for most of the children with autism to have. I think that there are some differentiations that I would like to note in terms of the visual contact, the visual. Sometimes children with ASD have difficulty with eye contact, and the children with SM have when they are expected to speak. But with their parents, if they don't have it, then we think about that. And I just had this week, I had a teenager who was in the office with the parent, and I saw the eye contact that happens, but it doesn't happen with the other ones. So I think that of course, the social interaction, the quality of it at home versus at school or other places. I think that the restricted interest we talked about, and it's more common in the children and adolescents with SM. I think that there are other areas too, which is the body language, the nonverbal behavior for children with SM may be typical with their parents, but not if they have ASD. It may be atypical, the quality of tone of voice and all that. And I think that there are other areas too. And one of the things too that you mentioned is the sensory modulation difficulties. And we did speak before that many kids with SM have such high levels of difficulty with sensory modulation, but they kind of control it at school at times. Some of them don't, and they develop defiant behavior at school in their with their SM. But most of the children go home, and that's when they let go of their control of the modulation, and they are extremely bossy, defiant at home. So we have to work with that behavior that is the origin, like you said, is really modulation, anxiety, emotional modulation difficulty. But we have to work with the parents at home, and in other ways, we work with SM at school. So I don't know if I answered your question or not, but
Yeah, I think it's more of like they can be motivated to do a goal like right in the moment. I always see it as in the moment. So if they're working on skills, and I just want to bring up the eye contact, the flat affect, and that as a big misdiagnosis. I'm not a misdiagnosis as much as a misunderstanding. How about that?
yeah,
And maybe a misdiagnosis, and
right.
then we can get into some kind of treatment considerations as well. But what I see when someone is uncomfortable, whether they're sensory overloaded in a setting that's loud, large, lots of people, whether it's something that's causing them anxiety, in my opinion, not always even just speaking, but some kids that have learning challenges, their anxiety goes up, they become very flat. They have a speech and language deficit. They can't put their thoughts together to say it. So to me, I always say it's like having a fever. Why do you have a fever? Why do you have anxiety? And so figuring out why these kids have anxiety, not just they're socially anxious, or I mean, yes, they may have that, but I see anxiety exists for other reasons other than a typical social anxiety. It's that these other challenges or these other whys of SM can cause anxiety. So, on a personal level, those that know of my work know that my passion began with my own child. So she had been not talking in school. She was completely like flat affect, very little eye contact, sat there, kind of stared at her paper, didn't interact with anyone, a very typical, almost ASD presentation. But yet she got out of the school building and she was the most verbal, inquisitive, chatty, social, talkative child, and it was a tremendous differentiation. But when she was going through this, and this, she's now turning 30, I, was being told by so many people, she needs to be evaluated. Remember, 30 years ago, right? Or 30, I, not 30, like 25, 26 years ago, I've been, I took her to people, right? And I was told she had autism. She was on the spectrum, and I would pretty much have to have her have severe, uh, intense treatments. She probably would never really function in the world. I mean, those that know my Sophie know she's a
Yeah.
incredibly competent young woman who's a physician. She just got board certified in family medicine, got
Okay.
married to an amazing guy, social with a lot of friends. She's as incredibly neurotypical as you can imagine. And so if I had listened, and I didn't understand, and although I didn't understand nearly to the level that I do now, this is what's happening to parents. They're getting caught up in someone that doesn't understand that lack of eye contact, flat affect in the moment or in the situation is not indicative of ASD. What is that child like at home? Again, I want to be clear. What is your child like at home? They
Exactly.
may be more, right? They may be more functioning with ASD at home, let's face it, especially if it's a very sensory overloaded environment. Speech and language deficits are more, what, as Dr. Evelyn Klein says, deconceptualized language out of the house. It's and in the school environment, so it's harder. And parents, again, can read their child. Oh, you're thirsty. Oh, you want milk, right? Like the child isn't even putting their thoughts together to say it because the
Yeah.
parent is reading them.
Yeah.
So my point is, a big differentiation to me is, what is this child like at home? What are they like out and about? How are they, have they ever had friends? Are they, when they're even with their siblings, do they have normal reciprocal back and forth conversation or social interaction? That to me is a huge differentiation, because you can have SM and be completely, even if you have language issues, right? We know 30 to 40% of kids with SM have some language issues, specifically expressive. So they may not be the most chattiest child at home, but they have appropriate social interaction. So
Yeah.
it's more social comfort versus social skills, where kids on the spectrum lack the skills, the social know how, and that causes them tremendous disconnect.
Yeah, I love what you said now, and I wrote down, I'm always taking note. You said it's more social comfort than social skills. And I think that we know that kids who grow up with SM are not appropriately treated, they don't develop the social skills, but they can more quickly develop the social skills because
Yeah.
their brains are wired. Let's remember that autism, the brain is wired differently, and that's why there is difficulty with social skills and relationships. I just want to give an example to illustrate what you just said. I saw a girl a few months ago who was diagnosed with ASD, autism, by one professional, was diagnosed with severe mutism by the teacher, who really couldn't diagnose, but they were concerned about that. But they didn't do anything about 504 IEPs, at school. And I was called in. And again, I listened to this girl at home. The parents gave me videos. And I also listened to this girl at school, and she was actually talking and screaming during recess with the other kids, kind of being a leader. But when the teacher asked an open ended question, she didn't answer. When I trained the teacher to ask a four choice question, like instead of asking, "How was your day?" or "How was your weekend?" which is an open ended question, she asked, "Did you go to the beach or did you stay at home?" And she was able to answer those questions. I immediately raised a question about apraxia of speech. And so that was assessed by a speech and language therapist. And that has to be somebody who is trained in SM. Like Evelyn Klein says, she has a protocol for that. So we can have like a speech and language assessment at school if the person is not, if the child is not going to talk to the person. But this kid did, because she didn't have SM at school. Only when she was asked questions that were open ended and she was being tested with open ended questions. Once she developed more comfort and self assurance that she had some right questions to answer, she improved with her symptoms of what one thought was ASD because she didn't talk to the teacher in certain situations and they thought she had ASD, and with the other people in the school. So I think that we need to be very careful and look at all those areas and all those other comorbidities that you mentioned, and to see not just if they are along with ASD or with SM, but also what else do we need to address to understand this child's impairment a little bit more, right?
Yes, no, definitely. And I see that a lot, that individuals with autism, they aren't as scared to talk. It's that they can't formulate speech in a way that most people think they can. Like you said, the open ended. So, what I find interesting, and again, I don't have research, but just clinical data, is that kids on the spectrum with SM, if they have the ability to speak, obviously they have to be even diagnosed with SM, they speak quicker than many other kids. It's just how you ask those questions. And so that's a big key consideration is I see this a lot where they become verbal very quickly because they can become verbal to the capacity they can become verbal. So if they're not able to handle open-ended thought-provoking questions and having give take back forth of conversation, it's you asking the choice, prompting if they're able to obviously write and read. They do that. They're not scared. They're not doing it in these settings because people aren't asking questions the right way.